Hi, I'm Dr. Shore. I'm the Professor of Clinical Medicine and the Associate Director of the Bone Marrow Transplant Program at New York Presbyterian Hospital, Weill Cornell Medical Center. I've been doing bone marrow transplantation since 1987, and I've been looking after cancer patients since 1985. And I tremendously enjoy my work. It's always been a challenge, and there has been much progress and change over the years in managing cancer patients.
What is cancer?
Cancer is when a cell in the body decides that it is not going to follow the normal regulation of cells. So everybody has cells that grow, your fingernails grow, your hair grows, your heart develops, your lungs develop, but at some point one of the cells in one organ can have a mutation or a defect that allows that cell to just grow uncontrollably and take over all the other cells. Cancer is not contagious. You cannot catch cancer from another person. You can hug that person. You can sit on their bed. You can kiss them. You can bathe them. You will not get cancer. Most cancers are not hereditary. Most cancers come just in one individual. They don't get it passed down from their mother to them or from their father to them. However, there are a few cancers that are hereditary. There is a whole branch of cancer called genetics in cancer that helps to sort out which ones are hereditary and which ones are not. Some breast cancers are hereditary. It's very important to talk to your doctor and to find out whether you have a more normal type of cancer or one that might be hereditary. If it might be hereditary, then it's important to have your children evaluated to make sure that they don't have the same cancer. No, there are many different kinds of cancer. Every cancer has different treatments. If your friend has cancer and you have cancer, first of all, you have to look at what kind of cancer it is. Some people have lung cancer and other people have breast cancer. Those are very different cancers. Some people have cancer in their blood. Some people have cancer in their brain. Those are all different. Don't think that they behave the same. They don't. And the treatments are different. The drugs are different for different cancers. And the cancer treatments can include medicine, can include radiation treatment, can include surgery. There's all different kinds of treatments for cancer. And if your friend has cancer and they have a treatment, and the treatment causes a problem or makes them sick, that doesn't mean that your treatment will cause that for your cancer. Every single one is different. Everyone is an individual. Every cancer is different. Every treatment is different. Never go by what someone else says about their treatment. Every person has their own individualized plan. Yes, people can survive cancer. There are different survival rates for different cancers. Some children's cancers have over 90% survival rate. Some other cancers are not curable, but we can treat them and help the person live for a longer period of time. So some of them are curable, some of them are not. Some of them have a certain percentage of cure. That is something that each patient needs to discuss privately with their own physician. There are many different kinds of research going on for cancer. There is research in laboratories where people study new drugs and they study new treatments and they study how the cancer cells multiply and divide and see if they can get them to stop dividing and stop multiplying in the test tube in the laboratory. Then there is research where patients are willing to try new treatments, and the doctors do studies where they give people new treatments and the patients agree to it so that we can learn more about whether we can do better. And most of our patients in a very strong academic medical center, like a university, like where I work here at Cornell, many patients agree to be in what's called clinical research, where we do trials of new treatments with patients. And sometimes those trials and those treatments are better than the current treatments that are available. So sometimes it's worth it to be a part of research because you may get more modern approaches. Home remedies, voodoo treatments, various shaman, vitamins, that kind of thing, usually does not help. It is a delaying tactic that people put their faith in, and they spend money and they put their prayers into these kinds of treatments, and they're really not designed to do what they need to do. What you need to accept is that science has to be involved in treating cancer. You need to go to a physician that has a specialty of cancer management, and that doctor will know where to guide you and where to treat you. You should not go for local remedies. They don't work.
Dr. Shaw, what do you think about our organization such as Kafika who try to help for cancer in Cameroon?
I think that there are many nonprofit organizations and government organizations that are trying to help people with cancer. There are many in the United States and many in other countries. Every one of those organizations has a goal and a role to play. And I appreciate all those organizations for what they're trying to do. Some of them are education. Some of them are to provide resources for patients. All those organizations, including Kafika, will be helpful to cancer patients. And all those organizations have cancer patients' interests in their best heart, and that's what they're trying to do. And I support any organization that will fund patient care, research, and improve the quality of care for cancer patients. Certainly, some cancers are preventable, and we're learning more and more about how to prevent some cancers. But certain cancers are definitely preventable. Smoking is one of the largest causes of lung cancer in people. It can also contribute to bladder cancer because the tar from the smoke goes into your urine. Smoking is a problem. Other types of behavior also can contribute to cancer and need to be prevented. Certain dietary approaches are helpful, and eating more fiber helps prevent bowel cancer. So yes, there are preventable things to do, and as a society we need to learn more about that. I think that your country needs to develop a very robust healthcare system where cancer treatment and cancer prevention and cancer research are part of that healthcare system, along with all the other parts of the healthcare system. And people have to develop faith and trust in that system so that they utilize it. Because only when people start going to the doctor and making that trip and discussing things honestly, only then will things improve. Thank you very much for asking me to participate in this, and I wish you all success in developing funding for this organization to help your local cancer center grow.